Have you crossed 40 years of age? Or you're nearing your 40 years? Has any of your relatives been diagnosed with any form of cancer recently? Any of your friends diagnosed with cancer recently and that is troubling you? If the answer to all the above questions is yes, then you should definitely watch this video to understand why it is important to undergo a mammography after 40 years of age. Hello everyone, I am Dr. Shrikant Bodke. I am consultant radiologist and today I will be talking about breast cancer and the importance of mammography in early detection of the breast cancer. Breast cancer is an incredibly common cancer. It is the most commonly diagnosed cancer in the entire world. Just to mention few figures, 1 in 8 women will develop breast cancer during their lifetime and more than 40,000 women die of the disease every year. And that's quite a big number. Now, in this grim scenario of breast cancer, there is indeed a silver lining, and that is, if the breast cancer is detected at very early stage, the cure rate is nearly 99%, and that is a very hefty cure rate. So now, the most important question comes is, how to diagnose or detect breast cancer at an early stage? And the answer is mammography. Yes, mammography is the most important tool or test which will help us in detecting breast cancer at an early stage. So what exactly is a mammography? Mammography is nothing but highly specialized X-ray examination of your breast tissue. In a mammography, your breast will be compressed between two plates of mammography machine and sequential X-ray images of your breast will be taken. At the end of mammography, we will get a mammogram. Mammogram is nothing but X-ray images of your breast which will show all the minute and intricate details of the breast tissue and its architecture. It will also help us in identifying any suspicious lesions, mass, lump or calcifications in your breast which can be further categorized into benign, that is non-cancerous conditions or cancerous conditions. So what happens if you get an abnormal mammography report which says that you have a lump or a lesion or calcification in your breast? Whenever an abnormal mammogram is reported, the first thing to do is confirm whether that suspicious lesion is indeed a breast cancer or not. For that, we will advise you to undergo a test called biopsy or FNAC, where a small needle will be passed into the suspicious area and tissue will be withdrawn from that area and we send for further testing, and which will tell us with surety that whether it is a breast cancer or not. Mammography helps in early detection of breast cancer to the extent that mammography can detect breast cancer 2 years before the patient can actually feel any lump or symptom. Now that itself shows how important mammography is. Now the next question is, when should a mammography screening start? I'm sure all of us, you will have this question in your mind that when should I get a mammography done? Is this the right age? And should I do a mammography every year? American College of Radiology and Society of Breast Imaging recommends that all women should undergo a screening mammography every year starting at the age of 40. Now, why mammography should start at the age of 40? Because it is this age or after this age, the risk of breast cancer increases exponentially and significantly. To mention few statistics, 1 out of 6 breast cancer detected will be in this age group. And that is why it is important that if the screening mammography starts at the age of 40 years and if it is done every year, there are high chances that we may detect many breast cancer patients which otherwise would go unnoticed and may land up in advanced breast cancer patients. To summarize our entire conversation, mammography is the tool which will decide that whether the patient is detected at an early stage or advanced stage. In a nutshell, mammography saves lives and in a big way. Thank you so much.